Joining me now to give us an important update on medical assistance in dying in Canada is Rebecca Vachon, Director of Health at Cardus. Welcome to 100 Huntley Street, Rebecca.
Thank you.
Rebecca, just recently at the end of 2024, the government released information about the impact of medical assistance in dying on Canadians and what that progression has been like. What can you tell us from this report?
Yeah, so the report came out about what happened with MAID in 2023 specifically. And what it shows is that MAID has continued to rise year over year. Work that Cardus has done has shown that we have the fastest growing assisted dying program in the world. We are now only second to the Netherlands in terms of euthanasia or MAID deaths as a percentage of total deaths. So in Canada, we were getting close to 5% last year, at 4.7% of total deaths in Canada in 2023 were from MAID. So this is really showing the juxtaposition between what Canadians were promised by the Supreme Court and by the original legislation, namely this is something for exceptional circumstances in the rarest of cases in this environment of heightened safeguards. And the reality has been that this is something that's routine. This is something that has just been accepted as normal and that many Canadians are receiving instead of a natural death.
And I think that's something Canadians can speak loudly about in the public square, but also in their churches, in schools. And we can share about this vision of expanding mental health resources for those who are having those kinds of challenges. Rebecca, something else that's of great concern is Quebec allowing advance requests for MAID. And what does that mean? What does that mean for the everyday Canadian?
So this is actually something that's quite unique in the world. There are very few jurisdictions that allow advanced euthanasia requests. And what it means is that someone can, years before they might actually receive MAID, make the decision that in such and such circumstances they would like to be euthanized. There are so many issues with this. For one, part of the whole premise and the safeguards surrounding the law on MAID was that you need to be able to consent. You have to have autonomy. And that means being able to consent immediately prior to receiving MAID because we recognize sometimes we change our minds on these things. Now, this would effectively remove that requirement and allow people that no longer have capacity to make decisions to be euthanized. It is such a difficult situation because there's so much stigma surrounding things like dementia and Alzheimer's. And there is research that shows that what we maybe from the outside assume about the quality of life of someone living with that can be very different from what they're actually experiencing. And it can be very difficult for people outside, including clinicians, to actually interpret the wishes of people who are, for instance, no longer able to verbally communicate that. We already have issues with MAID safeguards, with MAID monitoring, with transparency around this. So we really need to look at how is the system working or not before we continue opening up expansions to those who are incredibly vulnerable in that question of autonomy.
Rebecca, in the 9 years that since MAID has been made legal here in Canada, what has surprised you about the progression of MAID in our nation?
I think it's sad to say that not a lot has surprised me because these are the concerns that were raised before MAID was introduced, upon the legislation being introduced. And with each change we've seen, it's just confirmed what our fears were. I think that something that has surprised me in a good way has been the really diverse coalition of people that come together to raise concerns about vulnerable Canadians. This has been a really tremendous opportunity to work with people across different political views, across different faith views or non-faith views, but who are united in the common cause that life matters and we need to be good to one another, and that includes protecting our most vulnerable, especially from a premature death.
Rebecca, thank you so much for sharing with us today and for all you do to help protect Canadians from the realities of MAID, as well as the Cardus organization. We're so thankful for the partnership with Crossroads and talking about these issues. And you talked about the power of unity, and it is a silver lining in how we can take action to protect Canadians from MAID. Thank you so much for being with us today, Rebecca.
My pleasure. Thank you.